Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc.
Hello and welcome. I'm Dr. Megan Pesch, Assistant Professor of Pediatrics in the Division of Developmental and Behavioral Pediatrics at the University of Michigan Medical School, which is in Ann Arbor, Michigan. Welcome to this podcast. This episode is entitled, What You Need to Know About Screening Newborns for Congenital CMV. It's part of our 6-part podcast series called Let's Talk About CMV. Joining me today is Dr. Sally Permar. She is the chairperson of the Department of Pediatrics at Weill Cornell Medicine and the pediatrician-in-chief at New York Presbyterian Weill Cornell Medical Center. Welcome, Dr. Permar, or I guess I should say, welcome, Sally.
Thank you. Thanks for having me, Megan.
It is great to have you here, and you are such an expert in this field. So thank you for letting me kind of pick your brain and teach or inform our listeners about congenital CMV screening, which, as you know, is quite a nuanced topic. So, before we really dive in and I start asking you questions, I kind of wanted to take a step back and just do a quick little recap or refresher for our listeners about congenital CMV. So congenital CMV is an infection, of course, that a mother can get during pregnancy and pass through the placenta to the growing fetus. Actually, about 1 out of every 200 U.S. newborns are born with congenital CMV. And it is that prevalence is way higher than, Down syndrome or myelomeningocele or spina bifida. It is a significant cause of long-term pediatric disabilities, including sensory neural hearing loss, among many other things. One of the tricky things about congenital CMV is that most of these babies look absolutely normal and healthy at birth. So right now, the actual prevalence of diagnosis is quite low. So, there have been various studies, but many people estimate that it's probably about 1% of babies with congenital CMV that actually get picked up based on clinical suspicion alone, which is why, and it brings us to our topic today. Newborn congenital CMV screening is so important. So this whole podcast series is intended to bring awareness to clinicians about this virus. And I will stop there and ask you, Sally, can you introduce your role and how you manage or work with patients with congenital CMV?
Yes. So I am a pediatric infectious disease scientist and researcher and physician. And I specialize in the diagnosis, prevention, and treatment of congenital infections, of which by far the most common is CMV.
That's amazing. And can you briefly tell us, why is it difficult to diagnose congenital CMV in newborns?
Yeah, so CMV is a tricky diagnosis to make, and that is because it is kind of often a silent virus infection. When babies are frequently born with congenital CMV, as you said, 1 out of every 200 babies, or 0.5% of all babies born, only about 10% of those babies will be able to be picked up at birth because they have some kind of severe manifestation, like a rash at birth, or maybe severe disease like liver failure, or a very small head, microcephaly, we call that.
So can you then tell us a little bit more about why it's important to screen for CMV at birth or later on?
Right. So what's important that we don't miss those that do have CMV, but don't have some of those signs that we would pick up at birth, is that another large proportion of those babies who are born with the infection, another up to 20 or 25%, will go on to have some type of long-term disability from the virus itself. And that can be, as you said, commonly hearing loss as one of the main manifestations. There are other more subtle neurodevelopmental delays, things with issues of balance, issues of cognitive learning, motor skills, even can develop seizure disorders later on. But another important thing that makes testing very early in life so important is that CMV is a ubiquitous virus. And so it's very common for babies and toddlers to pick up the virus from another person or another toddler or their mother during the first few years of life. And so if we don't test the babies in the first few weeks of life, we may never know if they picked up a virus after birth or if they picked up that virus before birth.
That was a great summary. I think they really are two entirely different beasts, the congenital CMV or the postnatally acquired CMV. So can you tell us a little bit more? There are different approaches to newborn screening for congenital CMV. Would you be able to kind of give us an overview of those different approaches?
Yeah. So what clinicians do mostly at this point is test a baby who they see have symptoms or signs that would be consistent with CMV. Now, as we just said, that's going to be 10% or even less if a subtle finding is missed of babies that have CMV that will get diagnosed that way. So we know we need to move on from that strategy. The next strategy that has been tried is to test those babies who fail their hearing screen. It's been a great advancement that we now offer hearing screening for every baby at birth. And so that approach has been tried to tie the hearing testing with congenital CMV screening. And while that does pick up some additional babies that may have been missed with just clinicians deciding when to send a test based on findings that they have, what has been seen in now a couple of cohort studies is that this hearing targeted approach is really missing the overwhelming majority of the babies that would be diagnosed with CMV. You're missing up to half or more of the babies that will go on to have a diagnosis of CMV if you just screen those that fail their hearing screen at birth. And then the next thought is whether we could expand that to universal testing. So testing every baby at birth for congenital CMV. And interestingly, in early studies, it's been shown that it's more cost beneficial to actually screen all babies for CMV, who then can get plugged into services and even started on antivirals when they qualify for antivirals that will actually help prevent the long-term disease. And so this is something that we and other experts in this area are interested in furthering. And luckily, there are new pilot opportunities of studying this strategy popping up all the time now.
That's so exciting. I get excited when I see more and more data come out in support of universal screening.
And maybe I can just add that as a clinician who sees babies that get the diagnosis of congenital CMV, what we are often faced with is babies who get the diagnosis too late to know whether an antiviral treatment is going to help them or not. And that is disheartening to know that maybe we could have intervened earlier to start to arrest the disease process. And so that it is a consequence of not having universal testing.
Absolutely. Can you comment on the current recommendations for congenital CMV screening in the U.S. for newborns?
Yeah, so the current recommendations are to screen any newborn who has any signs and symptoms that may be consistent with congenital CMV. But then also what's recommended is if a baby does fail their hearing screen and it's confirmed to be sensorineural hearing loss, then those babies should also be tested for CMV. But what we don't have right now is every state having a recommendation to screen universally for CMV, but we're starting to see that happen. So excitingly, this year, the state of Minnesota put in place a recommendation for universal testing, the Vivian Act. There are several other states considering that. There's a couple provinces in Canada that are doing universal screening already and have been for a couple years. So we're starting to gain more experience, both with watching it play out in certain areas of the country, but then also a recommendation that it be put into place for all babies in certain states.
Yeah, it's been so great to watch those provinces. It feels like, it feels like every month there's like another state or province or, enacting a new legislation or, to start screening in some capacities. What is the key information clinicians should be aware of in terms of screening for congenital CMV? Like, what are the steps that need to be followed, for a timely diagnosis?
Yeah. And one area I might touch on before that even is the type of testing that can be sent for CMV. And this is, I think, where some of the testing recommendations have been held up in controversy or not knowing what the next pathway is going to be. So all of our newborn screening at this point for genetic diseases take place on a dried blood spot that's usually obtained from the heel of a newborn. And that is obviously very efficient. And if CMV could be added on to that test, that would be the easiest to implement. Some early studies showed that maybe that wasn't going to be sensitive enough for CMV testing. But some more recent studies have shown that maybe we could increase the sensitivity by improving on the test. In the meantime, some studies were done on testing urine and saliva because we know that babies and really everybody who acquires CMV will quickly start shedding the virus in all of their mucosal fluids. However, that would be a big implementation challenge because right now all of the newborn screening is based on a dried blood spot, and taking a second set of samples would be a big cost to the system. So the first thing to know as a clinician is if your baby was screened for CMV is to check what type of test did they get. Did they get a newborn dried blood spot, which may have some lower sensitivity, and therefore you could still think of CMV on a diagnosis if you think the baby has a disease that could be consistent with that. But a way to confirm the testing would be to check a urine or saliva PCR test for CMV, which have become very common and again have high sensitivity as well as specificity for the infection. Other important pieces to know is that only if the testing is done in the first 3 or so weeks of life can we be sure that the infection was acquired in utero and not postnatally. And so that chaotic first month of life really is the key time for getting testing done. Therefore, why the best would be to get it done at the delivery visit. But if you're a clinician seeing a little bit older baby, it's worth doing the testing, but know that if it's outside the first 3 weeks of life, there's the possibility that the baby could have picked up the virus even during the delivery process or later.
So if a baby is diagnosed with congenital CMV, I just like to touch briefly on the treatments available for newborns. So can you provide us with some insights on the roles of antiviral treatment for congenital CMV? And then I would also love your thoughts on the non-pharmaceutical interventions for CMV.
Great. Yeah. So some exciting work came out several years ago now that one of the antivirals for CMV, which has been one that has been used in adults and other patient populations for years, called ganciclovir, was effective in reducing the chance of hearing loss and improving on the developmental outcomes for babies that got treatment when they had very severe neurological CMV disease at birth. But what was unfortunate about that antiviral being the only one that we knew had some treatment effect is it was only available as an IV drug. But then some pharmacologic improvements on that drug led to it becoming an orally available drug called valganciclovir, or just modifying it a bit allowed it to be available in oral form. And so that's now recommended for babies that have no neurologic effects of CMV to be on that treatment, starting from about 1 month of age or before for 6 months. And then to answer your question about non-pharmacological treatments, the important pieces that have been identified is those services like neurodevelopmental services, maybe speech therapy, physical therapy, occupational therapy. Those can all be super important for children that have some cognitive deficits.
And the other thing too is, for some families with children with hearing loss, if it's severe enough, they may opt for hearing aids or cochlear implants. But there's also in addition, the option to learn, signed language or, different forms of communication. And so I think it's really just kind of putting, all the options out on the table. And so just giving families all the resources and all the options to support their kids and whatever feels right for their family.
Yes, exactly. And more information is coming out all the time, like some of your work on how common autism diagnosis may be overlapping with congenital CMV. So really that knowledge is power is an important part of the diagnostic as well.
Totally agree. Thank you so much, Sally. So in the current, kind of context at a national level, how do you think we can tackle the issue of CMV being under-recognized in newborns? Like how, from kind of a national zoomed out perspective, how do we make sure that all newborns with congenital CMV do end up with, the opportunities to access proper treatment and supports?
Yeah, it's been quite remarkable, and you and I both know, being in the CMV field and advocates for CMV, is that all the work that has gone into from a number of groups, a number of parent-led organizations, a number of providers, is years of improving on our education. When surveyed, women of childbearing age do not seem to be changing the proportion that actually know about CMV. It's been about 10% of women or of childbearing age have heard of CMV. And that has been, as long as I've been in this area, that's been the case. And so it's what we're doing is not working. So I do think that with the advent of universal testing and with the advent of new opportunities for diagnosis, prevention, and treatment will come the education. So I've started to see it the other way around. Not that we need to educate more, we need to put in place the access to the diagnosis, to the treatment, and to think about prevention and the eventual vaccine that is really going to take to put this disease out of business, is that we have to have the universal testing as part of that package.
Absolutely. So thank you so much for taking the time to talk to me, Sally. This was a great discussion.
Yeah, thank you, Megan, for all your leadership on these podcasts, educating and advocating for ending CMV. Thank you.
My pleasure.